All right, today we are diving into a really powerful story of resilience and, some incredible scientific hope. We're talking about a devastating rare disease and a brand new treatment that's not just been tested in a sterile lab, but out in the real world. And the results? They are truly changing lives. It's a story that starts with unbelievable fragility, but as you'll see, ends with some real strength. I want you to just imagine that for a second. What if the slightest touch, the smallest bit of friction, could cause painful blisters and open wounds? Well, that is the day-to-day reality for people living with a condition called epidermolysis bullosa, or EB. It's often called butterfly skin disease for that exact reason, that extreme fragility. And look, right from the get-go, I want to frame this whole explainer with this powerful quote from the medical study we're looking at today, because this isn't just about data points and charts. It's about real, tangible improvements in people's lives. It's about hope. So, to really understand why this new treatment is such a game changer, we first have to get a handle on what it's truly like to live with this condition. So, what is epidermolysis bullosa exactly? Well, it's basically a group of rare genetic disorders where the main problem is a flaw in the proteins that act like glue, holding the layers of our skin together. And without that glue, the skin is just incredibly vulnerable. And the impact is just relentless. It's not only the constant cycle of new wounds, it's the chronic pain, the severe itching, the constant risk of infection. Over time, this leads to scarring that can actually fuse fingers and toes together. And you can only imagine the emotional toll, the social isolation. For the longest time, there's been no cure, just what's called supportive care, basically trying to manage the wounds as best you can. But what if a real solution could be found somewhere totally unexpected, like in nature? This is where the story takes a really fascinating turn. Yeah, you heard that right. The breakthrough we're talking about today comes from something you might just walk right past in a forest: the bark of a birch tree. This is where science gets so cool, finding these incredibly powerful compounds just hiding in the natural world. The treatment itself is called Oleogel S10, and honestly, it's a remarkably simple idea. It's a gel made from these compounds called triterpenes, which are pulled from the birch bark, and then just mixed with sunflower oil. That's it. So how does this simple gel actually work? Well, it's not just a soothing balm. The science shows it works on a few different levels. First, it helps calm down the inflammation that gets in the way of healing. Second, it actually encourages the main cells of our outer skin layer to move into the wound and start repairs. And finally, it helps those new cells mature and form healthy skin. It's like a three-step attack on wound healing. Okay, so this all sounds great in theory, but how do we know it really works? Well, this is where we go from the lab, past the big clinical trial, and into the most important phase, the real-world test. Now, Oleogel S10 already did really well in a huge controlled study, which is why it got approved in Europe. But that brings up the million-dollar question, right? Does a treatment that works under the perfect controlled conditions of a trial work just as well in the messy, complicated reality of an everyday clinic? The difference between these two things is massive. A clinical trial is like a car on a perfect test track, but a real-world study, like this one from Colombia, that's like testing the car on your bumpy daily commute with traffic and detours. Patients might miss an application, or there might be delays in getting their medicine. Crucially, it shows if the treatment can work in places that don't have a ton of resources, and that is a vital test if you want this to be available to everyone. And the results from that real-world test in Colombia? Well, that's the heart of our story today. We're talking about numbers that translate directly into new hope. So let's start here. 27.3%. For the patients in this study, this was their starting point. On average, over a quarter of their entire body was covered in painful, open wounds. Just let that sink in for a moment. Now, look at this. After 2 years of using the birch bark gel, that average wound area plummeted to just 10.4%. That's a reduction of more than 60%. This wasn't just a small improvement. This was absolutely life-altering. This chart really drives that point home. You can just see that dramatic drop in how much of the body is covered by wounds over that 2-year period. And getting that kind of sustained improvement is so huge, because with EB, new wounds are always forming. And this is why it all matters. These numbers aren't just abstract. They mean real, everyday benefits. The study found that over 60% of patients were able to get back to school or social activities. More than half said they had better self-esteem, and, this is a big one, they were sleeping better, something that constant pain and itching often makes totally impossible. And, to make this even more real, the study published some photos. So this is the leg of a 13-year-old patient right when they started using the gel. And here is that very same leg just 9 months later. I mean, the healing is just undeniable. It's a powerful visual confirmation of all the data we've just seen. It shows you just how profound the change can be in a pretty short amount of time. Okay, so let's pull all of this together. What are the big takeaways from this groundbreaking report? Look, this might seem like a small study, but it is a huge deal for a few key reasons. It is the very first report to show that Oleogel S10 actually works in a regular clinic setting. It proves that the results from that big, expensive trial hold up in the real world, even in a country with fewer resources, and even when patients couldn't use the treatment perfectly. At the end of the day, the conclusion is just crystal clear. This birch bark gel offers a real, sustained reduction in the daily burden of wounds. And for a community that has had so few good options for so long, this gives them something incredibly precious, real, tangible hope. And it kind of leaves you with this fascinating question to chew on. You know, if a remedy for a condition this complex was just waiting in the bark of a tree, what other incredible breakthroughs for rare diseases might be out there, hidden in the natural world, just waiting for us to find them?